truly reflects our hospital's commitment to innovation, collaboration, and patient-centric care. Vertigo and balance disorder are conditions that can significantly affect a person's quality of life. They are often rooted in the complex neurological and vestibular system, requiring a comprehensive and multidisciplinary approach for the diagnosis and treatment. This clinic is our answer to all these challenges, a place where neurology and ENT experts come together and seamlessly provide world-class care. My warm welcome to our Vice Chairperson, Mrs. Prita Reddy, and Madam is source of inspiration for all of us and supporting all the clinicians and helps us to get the world-class technology for Apollo Hospital, not only for this hospital, across the group. And thank you, Madam. Warm welcome to you. And my warm welcome to Professor Michael Stoof, a world-renowned vertigo specialist, Professor of Neurology and Clinical Neurophysiology, Department of Neurology, and in German, Center for Vertigo and Balance Disorder, Hospital of the LMU, Munich, Germany. Warm welcome to you, sir, for your presence. And I would like to welcome Dr. Prabhash, Senior Consultant Neurologist, Apollo Hospital, Vanakkam, and Senior Consultant of Apollo Vertigo and Balance Disorder Clinic at Apollo 1 and Apollo Vanakkam. Warm welcome to Prabhash. And our Senior Consultant, Dr. Arul Selvan, Senior Most Consultant of Neurology Department. Warm welcome to Dr. Arul Selvan. And I also would like to welcome Dr. Vijay Shankar, Senior Consultant Neurologist of Movement Disorder and Deep Brain Stimulation Center, Apollo Hospital. And Dr. Venkata Karthikeyan, Senior Consultant ENT, Head and Neck and Skull-based Surgeon of Apollo Hospital with a special interest in neuro-otology. Warm welcome to Dr. Venkat. And my warm greetings and welcome to Commander Dr. Karthik Madesh, Senior Consultant ENT, Apollo Vanagram Hospitals. So big thanks and welcome to all of you who have gathered here, and our friends from press have come here, and big thanks to you and welcome to you, all the friends from press, because this is very, very important clinic that many patients suffer with a lot of vertigo related issues. Our doctors will take you through the details of this disorder, and many patients will benefit. So your support is required. You are all here, and warm welcome to all the friends from the press. With that, now I would like to invite Dr. Prabhash to take over.
I'm afraid I can only disappoint you. So I just want to make a few statements about Chakra. Chakra has a very bad reputation, and this was already stated by my kind colleagues. But actually, if doctors are well trained, then even general practitioners can make a correct diagnosis in 90% of the patients. In other words, you don't need these specialized doctors for the majority of patients. What is required that we improve the diagnostics in vertigo and dizziness. Education, 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 and self-confidence by the doctors that they know, yes, I can. And this should already begin in medical school. Although vertigo is so frequent, in medical school, in university, it's treated like an orphan disease. It's not part of the curriculum in a proper way. The second problem, and this is noticed by the colleagues here from ENT and neurologists, is that patients fall between the chairs of ENT and neurology. And although the title here is integrated, let me tell you, it doesn't work in clinical practice properly. So to put it in a positive way, a doctor who sees patients with chakra should be well trained. what are the keys to the diagnosis? So first of all, speak to the patient, listen to the patient. I see a lot of patients every week, general urology, on my own. And my first question is, Dr. Prabhash, why do you come to our hospital? And he will tell you the story. He's the best and primary source of information. What I actually do not do is to look at the files for two reasons. Either the diagnosis is already correct, then it's boring. Or the diagnosis is wrong, and then you are biased and have to make a U-turn. And the four key questions when a patient comes with chakra are very simple. First, the time course. Does the patient have episodes of vertigo, an acute onset, or persisting symptoms? The next aspect is what type. But that's waste of time because most patients do not discriminate between spinning vertigo and postural imbalance precisely, or they have both. The third aspect are provoking factors. Do the symptoms occur spontaneously or are they provoked by anything, turning around in bed, for instance? And the fourth category is accompanying symptoms. As you noticed, they can arise from the brain, from the extrapyramidal system. Almost all patients with Parkinson's, they initially complain of dizziness. It can be brainstem stroke with double vision. It can be hearing problem as in Meniere's disease. It can be headache as in vestibular migraine. So this is very important. Accompanying symptoms, provoking factors, so these are the four aspects. And then I examine the patient. And for examinations, we have just four tests. I look at the function of the vestibular reflex by turning the head to the right and to the left, to the diagnostic positioning maneuvers. Have a careful look at eye movements, do the positioning maneuvers for BPPV and the Romberg test. Then you have a diagnosis. You don't need machines. We have reclassified all vestibular disorders over the last 15 years. Doctors can download the diagnostic criteria from the Journal of Vestibular Research for free. And if you read them, you will notice almost no machines. It's about brain work, it's about listening, it's about physical examination. And this can be done by any doctor. Only 10% of the patients do need specialized centers like here, but the vast majority, and here in India, you have about 450 million people with dizziness. Yeah, so it's a huge population. This should be handled by the GPs, and very few come here. And once you have made the diagnosis, we can treat patients straightforward. The first thing is tell the patient what is the diagnosis. They need to know what they are suffering from. That's a great relief. And then we can have physiotherapy, we can have medication like beta-histine in Meniere's disease or other diseases mentioned, very rarely surgery. And one category which is often neglected, this is called functional dizziness. Patients are permanently dizzy because they permanently check their own balance. And this has to be diagnosed. It can be primary or secondary. And the treatment is speak to the patient and tell them what they should do and what not. So my take-home message is, yes, we can. We need well-trained doctors. That's step one. Begins at medical school. And then we need doctors who know, yes, I can. And then it's really nice to have dizzy patients. You should love your dizzy patients, and they will love you. So it's a win-win situation, and you improve functioning and quality of life in 90% of your patients. So be optimistic, straightforward, like your dizzy patients, and they will love you. Shukriya.
18 years, during which time this was a totally disintegrated approach, where the contention is always between the neuro and the ENT, and sometimes even the orthopedicians come into play for a diagnosis which we have then termed as cervicogenic vertigo, which doesn't even exist as we know now. So when it comes to the experience, the first experience was that we can learn no matter how senior you are in your specialty. So when it comes to dizziness, as Dr. Prabhash had mentioned, it could be anything starting from stroke to a peripheral vertigo. Now, how do we differentiate? We cannot be limiting ourselves into thinking only like an ENT specialist. So that is when the experience of interacting with neurologists had given me an insight into how to look at other central nervous system or a central vertigo related symptoms, signs, and how to investigate and manage. That was number one. Number second experience is that a patient who enters our hospital should know which doctor to consult. What if the patient doesn't know? In which case, we should be the ones who should make the patient comfortable, making the patient think that they are in the right place. They do not have to move from one consultant to the other consultant, shuttle between consultants. What we have established in Apollo Monogram is one such a setup where every patient of dizziness is consulted by both the neurologist and the ENT. The points collected are discussed together and a diagnosis is arrived and then the treatment is taken care of. Finally, it is that experience which has led us to this point where we are thinking to establish a multicentric approach. Let it be our Green Sword Apollo, Apollo 1, Apollo Monogram, Apollo OMR. So the experience has been phenomenal in terms of academic enrichment and also in terms of patient treatment and care.
And the friends from press. My job here is to give an introduction, take you through the basics, and then we'll have a detailed panel discussion. So, to find a solution, you should always find what the problem is. To know what the problem is, you should know you should know the basics. Only then you can find the problem. So, the balance system receives input from three sources. There are three sensors and one processor. So the first sensor is the vestibular apparatus. It gives brain the information about the movements that head and body is moving. And behind the vestibular apparatus, there are a lot of things which is happening, which takes the information, manipulates it, and give good information to the brain. And second is vision. Vision gives us information what's happening around us. And third is the somatosensory cues, that is from the nerves, muscles and joints. The brain will get information. Even we close our eyes, we know where our hand is, where our leg is. So information goes to the brain. So all these three things are compared, integrated and stored in the brain. As a kid, when we start walking, we don't know how to walk. It's a learned skill. Balance is a learned skill because there's an integration. There is a data store. Every time we move, the data is getting stored. So even when I stand here, I know that I'm standing in here, at this space, at this floor, what's around us. The information is being constantly fed. So as long as all these information from all these three sensors matches, there is no problem. So for example, we are in a train and we see the next train moving. What will we feel initially? For 2 seconds at least we feel that it's our train moving. And because the eyes tells the brain that we are moving, and it compares with the balance system and says that no, we are not moving. So the mismatch results in vertigo and all other disorders of dizziness and balance. So why an integrated neuro-ENT center? Because it's a shared team-based decision making with objective analysis wherever possible. So around 35% of adults above 40 has some sort of balance disorders. And almost 85% of individuals above 80 has some sort of balance issue. So it's pretty common problem. It's not uncommon problem. So the main problem is heterogeneity of the symptoms. The patient may say, I'm dizzy, I'm giddy, I have lightheadedness, I have motion sickness, I have instability while walking, I have gait disturbances, even syncope. When they say that, but when you go into the street, they seizure. So, thalai chutthudu, thallaatama irukku, gera irukku. We don't know what language it is, but then gera is a common word that is being used in our. And the most important is, Dr. Oru madriya irukku. Find what it is. So, we need to find. If it's that's the problem here. We have been teaching the wrong paradigm in the sense. If it's a chest pain, the patient is coming and going to tell us that I have chest pain. We need to find a DD for that. But here it's the other way around. We need to first find out what the patient's problem is and then find the diagnosis and then give the solution. There's an extra layer over here. That makes things little difficult. So a lot of effort is needed to diagnosis. So there are twin solutions that we are trying to give. One, upskilling the medical provider. That's what we are going to do over the next 2 days. We are going to do the Chennai Vertigo Summit, where the world-renowned experts are here. We are going to upskill the doctors to gain all the knowledge correctly to what to ask, how to interpret, and how to examine. And second is raising the awareness. Many times people come late to the system. Maybe 1 year, 2 year, 3 year. It's not days or weeks. So if they come early, we are able to find the solution, find what the problem is and give the solution. So this is about the conference. And the second point of raising the awareness, we are doing 2 activities. Dance for balance, where like an ice bucket challenge, we are trying to create an awareness saying that we are going to make a dance and then circulate it to the social media. People are going to do the dance. So indirectly, the message of vertigo and balance disorders spread around. And second is a cyclotron, what we are going to do, including our international faculty from Pondicherry to Chennai. I finished with 2 slides. So why are we doing this awareness? This question was put forth to Dari Simugal. So do you think that awareness raising events can help make people more conscious of the issues that we have been discussing? So he said that he would like patients to know that balance and dizziness problems are amenable to clear-cut diagnosis and specific treatment, which is usually successful. So his last piece of advice is, do you have any advice for patients who are currently seeking treatment? When you go for an assessment by a doctor, you need to come away with a discrete diagnosis and an appropriate treatment plan, or with a plan to refer to someone who can provide such a plan. Thank you.